In Maine's battle to contain the coronavirus, we are seeing some significant progress. Tonight, the number of people in the hospital with the virus stands at 357. That's down about 16% in a week. Today, Maine CDC Director Dr. Nirav Shah called that a, quote, welcome sign. 86 people are in the ICU, 37 are on a ventilator. The last time we saw numbers that low was late November. Today, the U.S. CDC updated its guidance for COVID infections in child care settings. The agency laid out exactly how long kids should isolate. It says kids with presumed or confirmed COVID should stay home for at least 5 full days. Kids over age 2 who are able to wear a mask correctly can return after 5 days if they do not have symptoms. But for kids under age 2 or those who struggle to wear a mask, the U.S. CDC says it is safest to isolate for 10 full days. The rules are similar for child care workers. Kids in child care, those under age 5, they're too young to get the vaccine. And we're seeing more kids in that age group getting sick with the virus. There is some good news, though. Generally speaking, kids are not getting severely sick, like ending up in the hospital. But doctors in Maine still warn the virus does not pick and choose who dies and who doesn't.
Ready, Kaden?
There was an early notion that kids don't get affected by COVID. And there were all these theories about why. And that may have been true early on in the pandemic. But with the Omicron variant, that's changed.
COVID cases in kids under 5 in Maine are spiking. 1,400 cases in December, the most since the pandemic began. The latest data from the Maine CDC show that about halfway through January, we're already close to breaking December's high mark. More than half of all cases in kids who are too young to get the shot in Maine happened from November to now.
That Omicron is infecting far more children than we saw with any of the previous variants, including children that now require hospitalization.
No one is downplaying the risk or the impact of a child having COVID. But thankfully, one finding that has held true is that children are not as severely affected as are adults.
Apples.
But doctors at Northern Light Health say parents may not want to take any chances, especially with those who are too young to get vaccinated.
We cannot predict who it is that's going to die from COVID, who it is that's going to require these hospitalizations. So if you care about those individuals, you care about the individuals around you, and you care about the individuals in your community, the best way to protect all of them is to protect yourself. And protecting yourself means getting your vaccine if you haven't started this series yet, or being boosted.